We're going to discuss on the alternative approaches for TDDS. The first one is iontophoresis. It's actually iontophoretic patches that use tiny electric current to promote your drug flow into the skin. Okay, it consists of a built-in battery layer. Treatment time is 20 minutes. Recommended maximum current is 4 milliamperes. And examples of drugs that have been used are lidocaine, dexamethasone, hydrocortisone, and acetic acid. So how it works, it has anode and cathode. So it has a patch with salt solution and a patch with a drug solution. So if you can see, the drug solution and the salt solution is of the same charge as the anode and the cathode. And why? Because if you have different charges, different charges attract each other, so you don't want it. So you have the same charges because it repels each other. So when you give the electrical current, it's easier to push the drug out into the skin. So you have the salt solution is for charge counterbalance. So this example of iontophoretic patches, and what I want to show you here is that you have the anode here and you have your drug here. And when you actually put the electrical current, the drug will be pushed into the skin through the epidermis until it reaches the dermis to reach the blood circulation. Okay. So there are three different types of mechanism that actually transport the drugs through iontophoresis, from iontophoresis. So you have the electromigration. Okay, so you have electromigration of ionic charge of the drug. You also have electroosmosis, and you have passive diffusion. However, in real life, electroosmosis and passive diffusion doesn't occur as much as electromigration. So it's much better to actually push the drug in through electromigration. So this example of one of the device is lidocyte. Now, first we have iontophoresis. Now we have reverse iontophoresis. So rather than you push the drug into the skin, you actually take whatever you need from the blood circulation. Okay, so now this is example is GlucoWatch for how to actually detect how much glucose you have in your blood. Now, GlucoWatch has already been discontinued, but I just want to tell you how it works. So, so say you have glucose in the blood. So with the cathode and anode, it actually attracts glucose positive charge. So with the electrical current, the positively charged glucose will go to the cathode. And there's a sensor here to actually detect how much glucose comes to the cathode. So that's how you actually see how much glucose you have in your blood or your extracellular fluid. So how it works is the sensor is composed of glucose oxidase enzyme. And when you put the microcurrent, it actually takes the glucose from the interstitial fluid of the skin, moved out to the sensor, okay, to the sensor. So then this glucose oxidase present in the sensor gel will convert the glucose extracted into gluconic acid and hydrogen peroxide. So this hydrogen peroxide is reduced to oxygen, and this will produce a current by electrocatalytic oxidation. So the difference in the current shows how much glucose you have in your body or your blood. Okay. Another one is sonophoresis. Tadi iontophoresis, we use electric current, while sonophoresis, we use ultrasound, okay, to enhance drug penetration. Now, it has been effective in formation of channels. You can see when you put ultrasound or ultrasonic device on your skin, it causes a channel. So this is your lipid bilayer of the skin, right? So when you use ultrasound, it will produce a channel. And when it produces a channel, you can easily actually permeate your drug into your skin. So the frequency range of ultrasound is between 20 to 25 kilohertz, while the power should be less than 125 milliwatts per centimeter square. Okay, it has been shown that for sonophoresis, it's more effective if you use it with iontophoresis. So you can get absorption up to 4,000% more if, rather than you use each of the devices individually. So drugs used in sonophoresis, quite a few: betamethasone, dexamethasone, fluosinonide, hydrocortisone, ketoprofen, and piroxicam. So this is how the device looks like. Another one is electroporation. Now, just now for iontophoresis, you have small electric currents, but with electrophoration, it has a transient high voltage of electrical pulses. You high voltage, you direct it to the skin, and you get rapid permeabilization of the stratum corneum. Therefore, you can actually target large drugs such as peptides, oligonucleotides. So it reversibly disrupts the lipid bilayers in the stratum corneum and produces a channel. So once you have that channel, you can actually promote the passage of your hydrophilic drugs or large molecular weight drugs through the skin. So this is example. You see that for DNA, that when the electrical field is applied, the ions you can see moved towards different side, and the charges, the pathways are then formed. Okay, so these are the pathways. So it's formed when you put the high electrical charge, and because of that, the proteins or drug can actually go into the DNA. So when the electrical charge is deactivated, the pathways then closes. So so it's back to normal. Okay, another one is